Most back pain comes from the discs. And the discs are basically the cushions that sit in between the vertebrae or the bones in the spine. So here we have the vertebrae of the lower back. We call this the lumbar spine. And in between each one of these vertebrae, which are the bones, we have the soft discs. And basically what happens is, over time, the discs start to get more brittle. So maybe we've worked in tough jobs, or we have been inactive, or we have small injuries over time. But what happens is these discs have a firm outside, like a ligament, and a soft inside, a gel-like inside. And what happens is, as we get older and these things get more brittle, they're more prone to getting hurt by getting little tears in them. And so what happens is, over time, the gel that's in the center makes its way over towards the weak side of the disc, and that gel will then make the disc bulge out. So if somebody says, I have lower back pain and pain that goes down my right leg, basically what's happening is, usually it's going to be because the disc is pressing backwards, closing down this hole, making this hole, which is supposed to be like this with a nice open hole. We call it a patent hole, and it's closing down on it. And so that person now will have pain not only from the disc problem in the back, but also start having pain down the legs because the nerve is being pinched. So now that we know that most back pain comes from the discs, what can we do for it? Really, there's 5 primary options that somebody has who has back pain. The first is taking medications. Medications are typically going to be a temporary solution that will help with some of the symptoms, but they still don't do anything to treat the underlying problem. The second thing we can do is physical therapy or physical rehabilitation, which is strengthening, what we call therapeutic modalities, different types of tractions and machines and that kind of thing. The third thing we can do is we can have spine injections, which are terminology is epidural injections, facet injections. Those can also be beneficial, but they're typically going to be more temporary also, because they also do not treat the underlying problem. You can do chiropractic treatment, which is a good treatment, but sometimes that can also be temporary. If we only do chiropractic, but we don't teach the patient how to do certain types of exercises and stretches that they can do on their own, and if you don't strengthen up the chiropractic treatments with physical rehabilitation type treatments. And then of course you can have surgery. And surgery is really supposed to be the last option. Hopefully someone has gone through every possible option that they could have, all of those first 4 options before deciding that they're going to necessarily have surgery done. So basically what we want to do is do something where, because we have a natural curve that goes forward, this would be somebody's stomach, we have a natural curve that goes forward this way, and the pressure is being put back here. So if you can see this, the holes are nice and open. Well, if I put a curve in there, if I get a narrower disc, if I get a bulging disc, those holes start to close down. So what we want to do is take the spine and basically open it up so that we're starting to get the holes more open. And with the disc decompression devices, we can't just get in there and pull just once or twice and have it actually make a change. After we do it 10, 15 times, not only will the pain abate, possibly the leg pain also, but the spine will get more flexible. As the spine gets more flexible through doing those disc decompression treatments, your back is much more amenable to, it's open to the chiropractic treatment, because chiropractic treatment is more effective when we've got some mobility or we give patients some stretching exercises. So then the chiropractic treatments can be directed right to that area. If it's really stiff in here, we want to get this area more open through doing the chiropractic treatments. At the same time that we're doing the chiropractic treatments and the disc decompression treatments, then we give the patients home exercises to work on, so they don't have to be in the office working on machines and that kind of thing. So with the Alaska Back Pain Protocol, we've done 3 separate disciplines as part of the treatment plan. We've done the non-surgical disc decompression, which is a machine similar to the DRS system. Secondly, we've done chiropractic treatment. And then thirdly, we've done the physical rehabilitation or the strengthening portion. And if you combine those 3 treatments together, not separately, not one now and one in another year, but all 3 at the same time, the results are synergistic, and the benefits all together make the treatments much more effective.